I'm a little bit intimidated, not too much from photographs and phones, but the amount of micros, I think it's the first time, and I'm not a politician, obviously, they're used to this stuff, we are not, but I'm extremely grateful to be back in India. I'm very grateful because we have been friends for many, many years. And at my age, I grew with this field of structural heart disease, dealing with not coronaries, but with the structure of the heart in every aspect. And I was very lucky to be part of that. And I look today when these treatments are basically state-of-the-art. When we started this early in the 2002, 3, 4, then obviously we entered a field that was highly competitive. Basically, it was a field that the cardiac surgeons dealt with. They had no competition because if you had a problem, then you went to a valve problem, then you went to surgery. And all of a sudden, there were these two crazy people that went up and said, no, we can do this also, what we did in the coronaries, we do now with the valves. And I can tell you the threats that we encountered at that time when we started those patients. They saw me in prison. Those were unethical experiments in humans. But you know, once you have a mission to complete and you know that you're doing the right thing for the patient, not for yourself, not under any economic aspects, you know you're doing the right thing. And not so much at the time when we started, not so much the younger patients, young meaning for valve disease in the 60s and early 70s, but we were dealing with the patients that even the surgeons, even though they didn't admit it, the more than 80-year-old high-risk or extreme-risk patients, those were the ones that we treated. Nevertheless, they saw the danger coming up. Danger meaning we're entering that field. And since this was very successful from day one, with two completely different platforms and approaches, the results of ongoing randomized trials were extremely convincing until today. Obviously, this is a very good sign for the field. Meanwhile, the heart team is daily practice, even though the surgeons have to do their job, and they cannot be in every cath lab case, but we are understanding each other, and we are basically looking in complex cases what is actually the best treatment for a given patient. It's a huge evolution of two completely different fields, cardiovascular surgery and cardiology or interventional cardiology, and structural heart disease kind of let them combine and let them to be together. A very, very important and very progressive approach, which is actually important for the patient. Having said that, we still have challenges to master. There's still some unresolved issues with everything. Nothing is perfect, but we are moving very rapidly forward, even discovering new shores, if you want, and we will cover those too. So to conclude, India is a huge continent with a huge mass of people that are diseased. Obviously, the economics are some limiting factors here. That's why the Indian products are entering the field. And I was impressed when I visited, for example, a company, Merrill. I was invited, you know, I saw Saturdays and Sundays, tons of young Indian computer freaks working on these devices, something that we don't see in the Western world so much. So I'm very happy and very proud that you invited me again to share our experience, to move the field forward, and I'm very grateful that we can continue the friendship in a, as you well know, in a rather turbulent world, politically, economically, and also racially. Thank you very much.